Hi, this is Lynette. I would like to share something. What is trigeminal neuralgia? Trigeminal neuralgia is your trigem nerve trigem is your trigeminal nerve that runs in three branches across your face. You have one on each side. They control the sensation of your face, the um, some of the movement of your face. When you end up with trigeminal neuralgia, it causes shock like pain, sometimes just like a annoying, uh, lingering pain that is there. There's two types of trigeminal neuralgia. There is typical, which is usually very well treated with medication. There is also untreated or atypical, which is harder to treat. I was told at the age 33, June the 10th of 1990, I had atypical trigeminal neuralgia. Now, they didn't tell me what I had for the longest time. I went probably 6 months before when I first got it in June of 1990. I probably went 6 months before they told me what it was. I flipped out on the doctor's office, and my mother was with me, and she said she cannot handle not knowing what's wrong with her. And the doctor said, well, we don't think she'll handle what's wrong with her. And she said, you don't know my daughter. She needs to know. She can deal with it once she knows. So they told mom that at that time, there was a 95% suicide rate, and I had something called trigeminal neuralgia. It is known at that time, and I think it was updated here in July of this year in one of the medical journals of being the worst known affliction to mankind. Um, Childbirth is a piece of cake, and I've had three kids compared to one incident of trigem. It takes your life over, you lose your life. And I lost my life. I lost being able to do things that you enjoy. You have to rebuild another way. The trigem has shocking, stabbing electric shocks of pain that at first they will only last maybe 30 seconds to a minute. The longer you have it, the more intensity it is until you think the pain cannot get any worse. The the longer you have, also the longer the episodes of pain last. Until finally, sometimes they will. It seems like when your nerve is in a thaw mode, I call them a thaw storm because when it's constantly thawing off, it may last days until you take the medicine and you actually get to sleep and go in a deep sleep where that nerve comes down. Once one of them thaw storms is what I've called them. Once one starts, about the only thing that I could get relief from it would be take the medicine and literally go to sleep, leave me alone. I would stay in my room where there was a ceiling fan hurt. You go to the grocery store, you cannot open the freezer up and get anything because it hurts. You can't eat ice cream. You can't eat watermelon. You have to microwave watermelon. Anything cold, anything hot are triggers. But atypical, I had a trigger spot right here. I had one right here. I have where the three branches join. I got a trigger spot. And then I had one at the second branch. But there wasn't internet back then. We are so blessed, that we can get online and find out what we have. Don't believe everything you read. But you can keep searching and searching and searching. You can look up doctors. You can find out who is the best rated, who not. You can find out, how many surgeries of that they do. Don't let somebody cut on your brain that doesn't know what they're doing. I was blessed to be sent to the world's best surgeon for trigeminal neuralgia. He was in Pittsburgh. Peter Janetta developed a surgery called microvascular decompression surgery. That he went into the cranial nerve area and he put Teflon between the blood vessels and the nerves to stop the pain. Now, some people, especially typical, they would come home pain free. Some, it would last a little while. Some, it would not. It wouldn't. Statistics are a trigeminal neuralgia affects 1.7 million people in the United States. An average of 1 in 100,000 people will develop trigeminal neuralgia. More women get it than men, and more older people get it, the younger people. Although it's very common, it does happen that younger people get it. People are born with it. I've read stories where a 9-month-old child was screaming every time they were in wind. They couldn't figure out what was wrong. They took the child to the doctor, and the doctor was very good and picked up that this child might have trigeminal neuralgia and got the child away from anything that would offend them and cause them pain. And the child did a lot better. But at that age, you cannot give medication for it. You just have to control their environment, which meant no air, no fan, no air conditioner, a lot of those things. 16% develop some hearing loss. 12% and undergo a second surgery. 10 years out, 70% of those that have the second surgery are pain-free. Atypical, there is a better success rate. I've known friends that have the atypical that took medicine for maybe a year and then stopped it. Now, it also goes into remission. You may be pain free and I was pain free for several months at a time. You think, okay, but when it comes back, and it always did, it comes back with a vengeance. So, you know, I don't know whether they could ever say you're totally cured of it. They're saying they are. My case, I don't know about that, people. I still want to better put your faith in God that He can help get you through it. He's the only one that can totally cure you of this or anything. Doctors can do all they can do, but God's the one that's got the last say. Remember that if you know somebody that is having pain on one side of their face, that is having shock like symptoms, that drinking cold does not hurt their teeth, it hurts their skin. Your skin hurts. Have it is something real. It's not in their head. Well, yeah, it is in their head, but it is something real. There is something they can do about it. Do not go on and on and on ignoring this and telling somebody, oh, it's all in your head. It doesn't work that way. Get help. If that one doctor does not satisfy or help you out, go see another one. I mean, I've been to some dingbat doctors, and that's exactly what they were, dingbats. But I've also had some very good ones. Please like this and share it, that we may get the word out together what trigeminal neuralgia is and what microvascular decompression surgery is. Thank you for sharing my journey with me, and I hope that it helps, knowing that regardless of what life throws you, God will get you through it, and you can overcome. God bless.